communities do you serve?
Awesome. Thank you so much for having me. So City Block exists to radically transform the experience of care for the most vulnerable communities in this country, for people who struggle with a confluence of the sequelae of a social system that undervalues individuals with chronic physical health needs, people who struggle with low income, people who have mental health challenges, all of those who have really experienced what it looks like and feels like to be poor and to be sick in this country. We provide integrated primary care, behavioral health, and social care delivered in person as well as virtually in our community hubs, our clinics, as well as in people's homes, that's tailored towards really meeting the needs of people who have often been left behind. We partner with health plans and at-risk providers, and we take a model of care that allows us to be aligned with long-term value. So we enter into value-based contracts where our Washington, D.C., and hopefully soon we continue to grow across the country. 3 or 4 chronic physical health conditions, and they're struggling to make ends meet, working a couple of jobs and trying to keep a roof over their head. The traditional healthcare system would make it really difficult for them to access the services they need. If you need to see a primary care doctor, you need to call a clinic. Typically, these providers are oversubscribed, don't have enough time to spend with people. You may have to wait several weeks to get your appointment. When your appointment comes due, you have to take time off work. You have to find childcare, get transportation to go to the clinic. You get there, you wait, often a really long time because the sort of experience of care is not super customer friendly. And if you're lucky, we know this, you may get 17 seconds out of your mouth before your provider, the physician or the nurse practitioner or the physician assistant interrupts you, just telling your story and explaining why you're there. If you're lucky, you'll get 10 full minutes of a clinical encounter, half of which might be spent with someone who's focused on the computer because they've got to document and get through to the next patient. And if you're really lucky, you'll have someone who writes a prescription or makes some recommendations